much of this is a 2023 story? What kind of momentum are we seeing from Big Pharma?
Yeah, good morning, Preeti. One of the key things that I think we've noticed now, I think it's a similar thing that you're seeing in the stocks of AI companies. They started the year not looking pretty yesterday, right? I think there might be a risk of that going on this year too, that people played the obesity wave or idea last year and now they're looking for rest or going elsewhere in healthcare. Now, that might be just a trading situation because this is, as you see the estimate behind you, that $80 billion is the number we're going for. There are people who've got a bigger number in 2030, right? 100 billion, etc. So it's clearly a very massive unmet need, and there's many reasons to be doing this in terms of trying to treat obesity.
Well, I think the timing of this is really interesting as well because you are seeing some of the bigger healthcare companies, I'm thinking Pfizer, Merck, among others, start to diversify their portfolios. Everyone kind of wants a piece of this anti-obesity weight loss medication. What does the competitive landscape actually look like? Yeah,
so it's pretty busy. One of the companies who's categorically said we're not in it is Johnson & Johnson. Interesting. They've made their pitch there. So this year, I think we're going to get quite a lot of interesting, not massive new trial that's then going to get a product to market. Yeah. But we've got data coming from Amgen on 2 assets. We've got data coming from Pfizer as to whether they're actually in the game or not with regards to their once daily oral. And then we've got data coming from a small company, Danish company called Zealand, with a mechanism of action that's completely different to the ones that are on the market today. And that will also be very interesting. It has a niche to play. Not everybody can tolerate these Ozempic, Wegovy, Mounjaro, and therefore there might be an opportunity for patients there.
Well, it feels like this is also an easy area to be regulated pretty aggressively as well. And I know there are some positives for people who have heart conditions, for example, and that's been proven in some of the research. Could that get in the way then of this industry meeting the $80 billion you suggest?
No, I think the pressure might come on pricing as opposed to, I mean, of course, there's always a risk with any chronic treatment of some side effect showing up after 3, 4, 5 years of treatment. However, the companies say that, look, our drug at the same dose has been on the market for 5 or 6 years already. We haven't seen anything. And that's a fair comment. But aside from side effects, price, I think, is going to be the thing. If we want to get to these kind of revenues, price has to give. And already, I think we're at the 50% discount to the list price that people see. One of the key things is to remember is that that's the only, cardiovascular is one thing you saw. There was a data that was just published completely independently, 15 years of treatment with semaglutide in treating diabetic patients halved the risk of colorectal cancer. You know, there's a lot more to obesity and the problems it causes than just cardiovascular.
But what's interesting is the global read-through it's having as well. I remember in the last quarter, Walmart, for example, had made a very big statement saying that because of these anti-obesity drugs, they're monitoring the consumer impact and how much people are going to be wanting to shop for things like food and groceries and of course, treats, luxuries, and when it comes to disposable income as well. I'm curious about the pricing, though, as well. Do you start to see some sort of trade-off when we're talking about these kind of medications?
Well, you have to assume that as the volume, as the interest goes up, the price is going to come down. There's no question about that. The question is, what is the right price, right? Now, in terms of then their impact on other industries, I think there have been some things that people have said that perhaps are more on the fun side than real side, such as airlines impact, etc. But in terms of consumer, I think the companies have to watch this. I don't think it's going to happen overnight because we're only treating 2% of patients today. Yeah. But they can see those patients, specifically people like Walmart who have a pharmacy, who can follow the same individual within their shopping habits too, to see whether there genuinely is an impact and then adapt. That's all it takes.
Who's buying this? Is this an American consumer story at its core?
You mean in terms of, well, look, obesity is a significant issue in the US, but all you have to do is walk outside in London and you see people walking around with extra pounds, and nobody likes that, right? I mean, people enjoy food, we all enjoy food, but some have have less of a control in terms of how much they consume. And that is not just a problem in the US, it's a problem in Europe, it's a problem in many countries, perhaps less so in Japan. But certainly not just a U.S. story.
So the market is actually truly global.
Absolutely.
A really interesting dynamic. $80 billion, that's the take out of Bloomberg Intelligence by 2030. That's the industry just for anti-obesity drugs.